Hi, everyone. AnneMarie Czyz here, your president and CEO, and welcome to AMC Connects Pilot Podcast, Episode 2. If you tuned in to Episode 1, thank you so much. If you didn't, it's okay. It'll be posted, and you can click on that and review. And I go over why the CEO is doing a pilot podcast, and I need all of your feedback. I've already received quite a bit of feedback, largely from Chuck. He's the man behind the screen, as I introduced in the first episode.
She was fantastic. So just so you know, she was absolutely fantastic.
So Chuck's putting the plug in. If you didn't tune in, please do and give us that feedback. We'll talk a little bit more about that in this episode too. Today's show is actually packed with a variety of information, including another special guest, which I'm so excited for. Being able to connect with all of you one-on-one in any way I get to is a treat for me, but this one's a wonderful one for sure. I do have some information to go over regarding new legislation that came out regarding revenue and potential Medicare, Medicaid cuts. So we'll go over that with a little bit more depth, and so excited that Employee Engagement Survey 2025 results have been out, and hopefully people have worked through. And we'll touch on that in a bit. And in episode 1, we touched on a tiny bit with Carolyn, some benefit structure. And so I'll talk a little bit about employee benefits, but that will introduce our special guest. Thanks, everyone, again for tuning in. And as I shared, I think it's an important topic. I have heard consistently since really the first week in July, many people, stakeholders, whether in the community, medical staff members, staff in general, many of us have been focused on the legislation that had passed, named One Big Beautiful Bill Act, or in short, OBBBA. And it represents a major shift in Medicaid programs and will function across the country. Nationally, the OBB cuts over $1 trillion from health programs. It's actually the largest cut that our nation has seen in American history, is what some of the documentation associated with the bill is. I did, on August 5th, I believe, coordinate some information to send out because there had been so much dialogue about it. And while many of the provisions will be phased in, it is kind of a complicated set of circumstances that will probably have the full impact in 2028. The impact associated with Rome Health is largely a multi-million-dollar reduction when and if all phases are truly implemented by the year 2028. And so hospitals like ours, I would think any hospitals really across the country, are facing some pretty significant headwinds associated with the dynamic, and preparing now for that particular impact is what we're all having a line of sight to, making sure that we stay focused on some of the great things that we've started and introducing some new items. I did touch on several of those components in the notice that was sent out the 5th, but I have heard from people that they don't always get to see their emails timely. And because I'm continuing to get quite a few questions on this, as well as there's been a fair amount of advocacy that we've seen even in Oneida County, Chuck will flash up some of the most recent advocacy that happened within Oneida County. A lot of information was kind of talked about towards the middle of August. What we anticipate is an increase in uncompensated care as some Medicaid beneficiaries lose their coverage. In addition, there will be less special funding available for safety net hospitals like ours that care for vulnerable populations, placing further financial pressure on the essential services that we do provide. When some elected officials reached out to me for a longer conversation recently, I did say that certainly I'm someone who doesn't panic, but any revenue reductions that healthcare faces in upstate New York is incredibly detrimental and can be somewhat scary. The nation's hospitals are also at risk for a $535 billion reduction in Medicare cuts starting in 2026. This is under the statutory Pay-As-You-Go Act. It's called PAYCO for short. which requires automatic cuts if legislation increases the federal deficit. While PAYGO technically mandates these cuts, Congress has historically acted to waive or mitigate these cuts in Medicare in the past, often requiring a 60-vote threshold in the Senate to prevent them. So as you can see or hear, the two components are the legislation. The federal legislation has a series of categories that they would be working through that do impact Medicaid directly once fully implemented, but it does also potentially trip the deficit, which would trigger a cut in Medicare as well under the PAYGO program. And so what does this really mean for us? At Rome Health, our mission remains steady and steadfast to care for our community with compassion and excellence in the face of change. We are focusing on what we can control, and staying focused on that is really the charge for all of us. Sustaining financial and operational performance so we can continue to invest in our people and technologies. Certainly, we'll talk about this, but being conscious of expenses and other things that we have to take a look at in terms of, do they provide value? Do they not? Always keeping an eye towards that. But we want to make sure what we do, the services that we provide, we do as much of that as we possibly can. We want to strengthen access to care. For the last 4.5 years, one of Rome Health's major strengths, when no one else could, is that we continue to open up access in all of our doors. We'll talk about one of our doors in the community with our special guests, but whether it's the emergency department or surgical services or primary care, we've worked hard and diligently to keep access open to our community, making deliberate improvements for operational efficiency that do impact and build a cost-effective high-impact care delivery model. So we want to kind of always look at our teams, how our teams are being developed, all of us across the network, not staying stagnant, but what's our mix on our teams? How can we make sure that we can deliver care safely, efficiently, with high quality? Preserving our role as a vital safety net institution. We do qualify as a safety net provider, which ultimately means, in its basic form, that we provide care to people that if we weren't here, wouldn't be able to receive care timely. And there's a variety of different coverage that safety net providers yield from the population that they serve. One of the focuses that we've had for a very long time and very successful, I always provide a shout out to Cassie Winter and Nate Smith on this, and that as a safety net provider, we do qualify for grants and other pathways to receive funding above and beyond our pay for the services that we provide, and we've been very successful with that. So incredibly thankful, but we have to make sure we stay rigorous and disciplined on those opportunities. We've already been transforming how we operate with a focus on long-term sustainability. This includes expanding access, as we've talked about, to high-quality care, modernizing our facilities to make sure that they're better for the community and they better meet the community's needs. We're so grateful for the grants that have been provided to us, as well as the philanthropic support from the community. Without that, it wouldn't be possible. We have not been in a financial position yet to be able to have fund a major master facility plan. So those grants and that support has been instrumental. But those environments of care are more efficient, and we're able to do more in a cost-effective way. Actively recruiting and retaining exceptional people. We've had wonderful orientation classes. I think our workforce has been blessed with rounded out skill sets and resources and new services that we've announced over the last several weeks, months, and years. A line of sight towards retaining everybody. We've made a lot of those investments, and we want to make sure that we keep everybody, thus talking about employee engagement today as well. Some of these efforts are even more urgent now than they've ever been in light of some of this changes, and many people are calling them headwinds. What it looks like from the front line, I talked a little bit about in the April 5th release. Every one of us plays a role in preparing for these changes, not by working harder, which we're all working hard enough, if not too hard, but by working smarter, being very intentional about the work that we're doing, making sure that there's value added. Sometimes I talk about this in some forums or when we're gathering together in teams to do project work, kind of looking in the organization for that white space. If something seems too hard, takes too long, patients waiting for things, all of that is something we want to take a look at, and we want to avoid and improve as quickly as possible, because where that is, there's dollars and patients don't like waiting around, or none of us like not being able to do our job every day because we don't have what we need. We want to help our patients heal faster by encouraging them for some basic things when they're in the hospital, that they're getting out of bed actively with a lot of support, some patients from us. But we want to keep our patients progressing forward. As a reminder, the hospital setting is the highest cost setting in the whole spectrum of the network. So we want to make sure those hours and minutes of the day are as efficient as possible and patients keep moving forward in their health, and we reduce or help prevent any complications that patients can have. We want to make sure we ensure patients are in the right place for their care at the right time, whether that's an inpatient bed, an outpatient clinic, or home. We want to work with our partners in the community, like Essentia Health, to make sure if people need home care and qualify for that, that they're able to get that care. Really important, because we want to keep patients and people in their home and as close to home as possible for as long as possible. Something as basic but tremendously important for our revenues to document care accurately and thoroughly, ensuring we're reimbursed fairly. I think I said this at episode 1, which is we really just want to be paid for the work that we actually do. But in healthcare these days, it's pretty complicated. So we have to make sure, from the care we provide to capturing that care in our documentation to all the great work that our RevCycle team members actually do. Ultimately, protecting access to care by managing schedules and reducing no-shows, making sure our time and resources are available when we need them. You know, many of our clinics across the network are just doing a phenomenal job trying to address no-shows or clinic visits. Very proud of the Sleep Center. They're so proactive in terms of making sure that patients have exactly what they need so that they end up showing up for their visits. So really proud of the work we're doing across the network, and we need to continue to do that. As we plan for budget 2026, and that's coming on us pretty quickly, we will continue to keep some of these categories that are resulting in cuts over time so that we can be very proactive on how we're structuring the work that we do through Rome Health. So I'll keep you updated. Again, there's a lot of advocacy out there. If you didn't get a chance to see some of those images, rewind, or maybe Chuck can put those up again. But there's a lot of elected officials that are getting in the know about some of the impacts associated with the OBBA. So if you do have relationships or have some energy to reach out to our elected officials to talk about it on behalf of Rome Health, always welcome your support in connecting with our elected officials. Well, with that, on a lighter note, I want to be able to talk about employee engagement 2025. Really wonderful. I'm so proud of the network. Although my goal is always to have 100% of you participate in the survey process, we did reach our goal, 75% participation from our employees. Great job. Thank you, thank you, thank you, right? Woo, we can do some clapping.
Woo, yeah.
It's very, very exciting. I still continue to hear from some of you across the network that there's a bit of a fear factor that we could find out. Who was doing the survey and direct results directly to people. As always, I'd like to reassure you that's not why we're doing employee engagement surveys. It's more of kind of a global effort to see where people are and how connected, what's working well here, what might not be working well. And then always people provide some really great comments to let me know what maybe ideas that we haven't been thinking about within the year that we have to launch. I did send out a little bit of information on the difference between confidentiality and anonymity and making sure that people feel comfortable and confident to participate. But the process is, and you should have already received some of the results for your department, really neat that we did continue to follow the Press Ganey recommendations, which is to have a global driver as well as to have a department-specific driver. So the global driver is really important this year, that we do have in selected communication within work units is effective. That was actually one of our lowest scoring items in the survey, and probably not a surprise to some as I start talking to people about that particular work. What I hear and saw in the survey was one of the highest scoring items is people really enjoy who they work with on their direct team, but it's harder to work with people in other departments. So excited to be able to work with all of you on that global driver this year. But again, working with your units to select that unit-specific one. I think it was a couple years ago. I did have an employee when I was doing a forum that asked me, well, AnneMarie, do you do a personal goal or a department goal at the administrative team level for employee engagement? And I had said, yes, I do have ongoing performance improvement plans. We'll go over them in the podcast and in other forums. But this year, as we worked through some of the administrative team results in the employee survey, there was an opportunity around resilience building. There's a lot going on in healthcare. It's kind of a wild ride these days. People, as I said, call them headwinds. So quite a few people carry a great deal of stress with them. One of the indicators of resilience, or resilience might be shaky, is if you carry home with you all your work, whether physically, mentally, emotionally, and that's something that if happens on a regular basis over time can create burnout. So that's a category that the administrative team was low in that we want to be working on for that particular team, as well as the global driver with the whole institution. So have fun with your results by department and have great conversations. I was just reading something that Jeff Bezos, I believe he's the CEO, Chuck, right? CEO of Amazon, isn't he?
Correct.
Yeah. He was talking about, as he was leading that organization, regardless maybe of what you think of him, kind of a interesting leader. He was talking about that if meetings and teams that get together don't have a lot of robust conversation, maybe even a little conflict that you can resolve in the moment, that he says we're not really getting at the heart of the work that we need to be doing. So I encourage you to have those meaningful conversations at the unit level. And thank you again. Probably equally as important as participation rates, Rome Health had a statistically significant increase in employee engagement from 2024 to 2025. Very proud of that. We reached the 25th percentile. Employee engagement's kind of like a basketball game if you're a sports person, and that the higher the score, the better. So to reach the 25th percentile was positive, or have that line of sight towards 50th percentile. We want to be better than average at some point in the near future. So we'll all work on that together. But congratulations for being engaged, staying engaged. I ask for that often. Can't do it without you all. So thank you. On the employee benefits front, Carolyn had touched on in episode 1 that when I asked her, what could the CEO be doing better here at Rome Health? And she had said, well, I think you're doing it, AnneMarie. You know, trying to acknowledge people with pay and the overall benefit structure. We've moved the needle a little bit. That's an area of focus for me, for us, for the organization. But we also have here at Rome Health some benefits that people have shared with me they don't know about. Some people call them softer benefits, like the team building activities that we have, maybe for specialty specific days that are celebrated annually, such as Nurses Week. I think the nursing department does a really neat job of trying to emphasize that and having all of us, maybe that aren't directly in that department, participate in that, and they have a fun time. We also have Healthcare Week. That's always a wonderful week where we get to celebrate people. We get to celebrate all the work that we do. And maybe that's not all of us, our ways of kind of enjoying our workplace. But for a lot of us, we like to just continue to connect with each other and live life at Rome Health together and celebrate our unique roles that we bring to the organization. So there's some wonderful soft benefits like that happen in the organization. Some people have shared that they didn't know that we have ladder programs, professional development, that here at Rome Health, we do believe in building the workforce with certainly outside expertise. Like I came from outside Rome Health and get to join this wonderful team. But we also have professional building from within the organization. We want people that are here to stay here and thrive here. And so the ladder programs can be a nice approach where people can learn some things differently, either within the specialty or maybe go on for additional education. And if you wanted to shift roles, that's available. So those are really neat things that we have here that we believe really rounds out the benefit structure in a variety of different ways. So making sure that we have pathways to engage all of us is just a high priority for myself because I think it's a high priority for all of us. But looking for your feedback. Coming forward, Human Resources and our small employee engagement committee is going to list a number of those employee benefits that aren't really clear because they transcend multiple different policies or standards of care that people might refer to. So more to come on that with FAQs. But I'm very excited, as I said, to be able to introduce our second episode's special guest, because I think it lends right to a wonderful benefit that I knew early on in my career, which I just absolutely loved. I'm joined in today's episode with Bre Kubik. Is that how I pronounce it?
Yes.
Okay. Bre's with us today to be able to talk about her role in the organization, which is just tremendous, but also a wonderful benefit that we as employees get to partake in. I've just switched over into that benefit, and I have to say I'm gloriously happy, and I've been in the same place for a long time, but I'm doing quite a lead up. Again, so excited to be able to have this conversation with Bre. Bre, can you share with us your role for the organization?
Yes, thank you for having me.
Yeah.
I'm excited for this. But I do agree that, getting everyone out there to understand the pharmacy. I am the supervising pharmacist in the retail pharmacy here. We are the outpatient pharmacy. We have our Oak Street door to the public. We also service employees here, and we have our Meds to Beds program for discharges. So yes, we have employees, mostly, we love to see them, come down and with our MVP employee insurance, there is a wonderful benefit for the hospital is paying for the copays for prescriptions that go to MVP this year at our pharmacy.
It's so great, Bre. I do have to give you a shout out because I've gone. I'm old now. It feels like people say, "AnneMarie, you're not old. You're not old." But
No, you're
you are
not.
as old as you feel sometimes, right? Yeah. But what I mean by that is I've gone to like the same pharmacy like for 20 years, and certainly have some relationships there. And recently, because I'm on our insurance, had the privilege of transitioning to our pharmacy in you, and it was so wonderful because there's steps, right? Can you just kind of walk through how you and the team in the retail pharmacy kind of support all of us that might need to transition into this benefit?
Yes, so Ethan and I are the most common faces you'll see, but we try to get your prescriptions from the provider. New York state law, we are allowed to transfer a refill from another pharmacy as long as it's not, certain controlled substances or whatnot. But your refills will stay at the original pharmacy. So the easiest way is to get a new prescription from your provider. And our providers here, especially primary care and the specialties, are great with kind of working through that. If you're not, quite due, you're in the middle of a refill, they will send it and we will keep it on file till you are due. So it's kind of a great team effort with that. But, we also have the option to do payroll deduction for over-the-counter items or for items that do not go through MVP. So that is a nice benefit, too, for employees.
I do. I think maybe before talking about some of the softer side of that, you and Ethan are amazing. We'll get to that. But I do think compliance with medication management, like the way you just outlined that, it's such an opportunity for a variety of different people and populations. Don't you think that's true? Like the way kind of shepherding people through. Do you find that medication compliance is an issue?
Yes. I think too, someone will say I'm low on this medication, so they'll call and we'll look and kind of make sure that, last time they filled it, were there other medications they got the same time that they might also be low on, and, kind of help, suggest different ways to remind to take them, or, a pill box or different things like that, really.
Yeah. Yeah. Can you talk to us, Bre, about any things that we should think about if we haven't enjoyed this benefit yet, what we may need to do to make sure that we can transition to our pharmacy and take the benefit in?
Sure. Yeah. So just the biggest thing really is get your, have the provider send their prescriptions to us, and give us a call, email us, stop down, make sure we have, your insurance ID. We also have the option to save the Alera card is how the hospital pays for the copays with the MVP, so we can save that to your profile, and we make sure we have everything up to date and get you situated.
It's so great. I do have to say, the first time I used my Alara card, Bre can attest to this, but she's so confidential, she'd probably never say this to anybody. Like, I put it in, I was like, are you sure I don't owe anything? I think I said that pretty quickly, and I was so excited. It was like I had like a coupon or something, and, it's just nice. And I think one of with all degree of seriousness, when we were talking through resilience building as a team in our administrative leadership team meeting, kind of some of this inflation crisis that's going on, these are things that really do make a difference in our lives, especially if we're on medications for longer periods of time, that this could be something that enhances two things, being able to have benefits, but maybe even decreasing our stress just a bit. When I was going to go into the softer side, it is so wonderful actually going in to see you and Ethan. Like, I love that. I mean, you guys are wonderful employees anyway, but it is just nice to take a few minutes. It doesn't take long. It's so quick. But just to see you and Ethan, do you have as nice of a dynamic working together as it looks like?
We always joke around because I've been here for over 11 years, and Ethan, I believe, is 22, 23. So we always joke that we spend more time together than our families. Like a brother sister kind of dynamics. It's pretty fun. He keeps me on my toes.
Yes. He seems to have these quick quips. I'm not
He's
very
very
good
quick.
at that. I've always wanted to be funny, and I'm not. But he does something, and he makes me laugh every time I walk in.
I don't know if it was Ethan, you, or me that came up with it, but we say that he has prepared me for children.
Bre, tell us how many children you have.
So I have 3 boys, all of which were born here, and it was absolutely fantastic experience.
Wonderful.
Mm-hmm. I give the department, maternity, and other departments as well, but it was. I don't know if we'll have more, but if I did, it would be here.
Oh, I love to hear that. How was the first birthday?
It was great. It was great. It took him a couple minutes to realize the frosting on his cake was something he could eat and tasted delicious, but he devoured it.
That's so sweet.
Yeah,
that's
cute.
wonderful. Well, you said 11 years here at Rome Health. Why have you stayed so long? That's a wonderful tenure.
Well, I actually was a student here, pharmacy school, prior to starting here, and I initially then was attracted to the closeness, the community of here. And so when the job opened up, I was very excited. I really feel like it's a team here. I feel like it's a very close family here. And I think that not only does it help, make you happy to come to work each day, but I think it kind of helps, teamwork gives the best care for employees or for our patients and the public.
Yeah. That's interesting. Some of our Press Ganey patient engagement scores actually do have a couple questions where you are gearing towards, which is how the team interacts with each other. Mm-hmm. So it kind of lends to what you're saying. If we're happy working together, it's really going to transcend to our patient care for sure.
We do a lot too with multiple floors throughout the building with meds to beds, and we work with post discharge for inpatient, for surgical, and it really does kind of take a lot of teamwork, the different pieces to make sure that we can get the meds, everything is covered, and there's no problems with payment. We can get it up to the patients and make sure they understand the medications when they go home. I think it is a big role to help with decreasing readmissions.
It's huge. Mm-hmm. It's huge. Like going back to the first topic with the OBBA, I mean, that's a wonderful example on how to continue to transform and work the operating model of healthcare so that patients don't have to, the compliance, right. And then to your point, readmissions is still such a major issue in healthcare of people coming back after they've been discharged. I'm glad you brought up the Meds to Beds program because I wanted you to talk a little bit more about it because I don't know that everybody knows about Meds to Beds. And when we think of provider retention, I've had hospitalists and I've had members of the Department of Surgery who've shared with me one of the reasons why they enjoy working at Rome Health is because of the Meds to Beds program. Like it really pops out in their minds about an efficient way to be able to take care of patients. So tell us just a little bit more about that.
Sure. So we will receive the prescriptions prior to discharge. If it's inpatient and they've been here, they're starting a new medication that might be a expensive medication. Sometimes we have hiccups with insurance with covering it or a high copay. The last thing we want to do is, your medication's $400. See ya. So we work really closely with the providers to make sure everything is covered and that it is something that is affordable. There is a full team of the pharmacists on the floor that also work with the providers from the inpatient pharmacy that help with that as well. And then with, surgery side, if they're here for a procedure and they're on their way home, the last thing, we hear they want to do is go wait for a prescription at another facility, another pharmacy. So we really try to get the prescriptions up to them, make sure they fully understand it, and, can go home and have what they need to get better.
Great. Oh, it's so wonderful. Do you think there's anything we can do to enhance the program for Meds to Beds or get out better our benefit in the pharmacy with our medication program?
I don't know. I think kind of educating the newer staff as they're coming in and reminding everyone really the different pieces and of getting them prescriptions to them. And I think why we're doing it is the biggest thing.
The why is huge, right? Because medications are a lot of steps in and of themselves. So the why behind it all, really helpful. Switching gears a little bit, Bre, maybe to put you on the spot. Things at Rome Health that you could think about we could be doing better. Is there something that, with your years of service and the lens that you look through, what's your thoughts on that?
So I think my favorite thing about this organization is the closeness of the family model here. And I think continuing to get to know coworkers and getting to know everyone on that personal level. I think, if someone's having a rough day and kind of knowing why and maybe be there to pick them up because we all kind of have those days. So I think that personal connection and teamwork and friendship, I really think is the building blocks for us to be able to do our job to care for the community.
That's wonderful, Bre. I can't agree more. I think I've said this at a few forums, and I think I have this in my orientation welcome where, boy, if you feel like as an employee that you can look over your shoulder and somebody's got your back, the likelihood of you staying in that team or in that workplace is really high. So you're just really reinforcing that. As we close our time with you, it goes by so fast, recommendations you have for me to be like the best CEO Rome Health could possibly be?
I think kind of what you're doing is continuing to get to know the employees and getting to know, the ins and outs of everything. I think you're doing a fantastic job. I think you've been charging the way through all these exciting changes that, we've been seeing. And I really feel like you have a true open door and are willing to get to know us and not just, I think you're really taking the role and doing great with it.
Oh, thanks, Bre. How about recommendations for our employees? Like you said a little bit of this, I think, in the dialogue, but I love that you challenged us to make sure our heads are up, like look out for each other. But is there anything else you could share to employees that could help them connect?
I think really just kind of managing, making sure that the work-life balance isn't key. I think that is fantastic to keep everything strong here and, taking pride in our job and our duties. And I think that is the building blocks to all the steps of healthcare, really.
Well, thanks, Bre.
Yeah, thank you.
Thank you for being with me.
Thank you for having me.
Appreciate it. If you haven't been to the pharmacy and have not met Bre or Ethan, I encourage you. And if you're not on the benefits plan, I'm telling you, when I put my card in it was awesome not to have a copay. I just really, again, felt like somebody had given me a treat. And I don't mean to make light of that. It was really nice, and it's a wonderful benefit, and the organization works hard. Human Resources, Ryan Thompson, our Chief Operating Officer, to try to construct a health benefit structure that's for us as employees. But if you do see Bre in the next little bit, just give her a superstar hands, right? Chuck, superstar. She's our superstar.
I keep turning off my mic. Superstar.
Superstar. We're kind of dating ourselves, Chuck and I. We all want to
No, we're not.
Yes, that funny quip of where it's coming from. Okay, as we start to wind down episode 2, just want to be able to announce that in August, we were the presenting sponsors at Nessentia Health's Jazz Fest. It's a wonderful event in the community. I believe it's the second year that they've had this particular event. So grateful that Chuck could take the time to go out and snag some pictures and be with us. Kate Rolfe and myself got a chance to just kind of connect with the community and say what being good neighbors and friendships in healthcare in this community mean. We need to work together. We need to build bridges. I remember learning from one of my mentors in healthcare who had shared that, you can do healthcare yourself, and that's really important. Rome Health takes responsibility for a lot of the healthcare in our community. But there's also an opportunity to think through, well, does somebody do it better than you? And do you need to acknowledge that and work differently with a particular partner in that vein? And or do people belong within your network that you can work with in a way that is really tight so that your patients can have what you need? And so kind of thinking through that, Nessentia is one of those groups. So it was really wonderful to be a presenting sponsor. It's a sacrifice for us. We do not have a lot of income to be able to do that, but we do want to make sure that the community knows that we're here. And if they haven't sought healthcare from Rome Health, then they're a resident of our catchment area that we need and want them to come to Rome and encourage them to do so. So that was really nice. Again, if you didn't tune into episode 1, I'll do a quick review. We've got a mailbag here on the Pilot Podcast, AMC Connects, and we did receive one of our first questions, which I'm really excited about.
So excited! Send in those questions.
Thanks, Chuck. Yes, send in those questions. Our goal is by the next episode, we have at least 3. I do know that there's at least 3 people out there that have a question, a concern, a comment, or even some feedback. And remember, if your question, comment, concern, or feedback is selected as a major topic for the show, you get a prize. You get a prize for even turning in a question, comment, or concern, or if you're a special guest. So Bre was a special guest, and she gets a little bit of our token. So she's only, the second or third person. So we'll see that get those special tokens. So the thought and the question is, I'm excited to hear the new limited podcast series, and I think it is a great way to reach a broader audience. Thank you for the affirmation. More to come. My question to AnneMarie is, with mounting financial concerns for healthcare institutions and the growing need for access and outreach for healthcare in our community, how do you continue to find joy and purpose in the work? Respectfully, this employee, that I'm really honored by that question. I probably could spend a whole podcast on it. Maybe we will if others want to know more. But I'll respond with, because it was personal to me and the word joy was used, I'll kind of start through the lens that I look through, which is a faith-based lens. I do get my energy and joy from my relationship with our Lord Jesus Christ, and been grounded in that faith for a very, very long time, and believe that's a fount of joy that kind of feeds me for certain. So I do have to say that because it was a personal question, and I saw the word joy in there, and believe that that comes from our Lord. Moving forward, though, I certainly, like all of us that are human, do have some of these concerns or these mounting pressures, as was worded in the question. So I try to stay grounded, of course, that healthcare in particular is uniquely local. Bre was talking a little bit about that in her time with us. But being with each other, ensuring that the organization is a flat organization. And what I mean by that is we're connecting with each other, we're working together, we're making sure that the work we're doing is truly value added. And if it's not, we ask questions about it. We shift, we change. One of the main reasons I came to Rome Health, and it was in one of the most challenging times of my professional career, I think the world in terms of healthcare, because it was the height of the pandemic. And I always remind myself the reason I came to Rome Health is because I had assessed and evaluated that it was a community and it was an organization that had this very unique grit, which is really this strength that comes from adversity. And not all places can garner strength from adversity. And in the midst of going through the challenges that the pandemic was thrusting upon all of us, Rome Health didn't even know it was emerging with a level of strength that I saw could be a great light within upstate New York as a solution to healthcare. So I do let that fuel me. I will say I do let the small things fuel me as well and give me purpose. Every life that we impact, every life that's saved, and I get pulled aside because I get to be the CEO and I get to shoulder certainly some of our challenges, but a lot of our strengths. And I choose to let that wash over me and fuel me, and it does, and have a deep sense of gratitude over that. So probably the last thing I would say is one of my mentors spoke once, a long, long time ago, when healthcare was facing another set of revamping, and it was scary. And I remember someone asking a similar question to that person, and the person shared that there's always going to be something, and we figure it out. We figured out this. We figured out HMOs. We figured out PPOs. We figured out all these things. We'll figure this out too. What's important is that our mission, vision, and values and patients stay at the center. We continue to question respectfully everything and all that we do, and we stay focused on our local care being the best it possibly can be. I hope that answers your question. It was a great one. I'd love to talk about it more. On the personal side, if part of the question was because I carry a sense of joy and maybe energy, I genuinely do feel it. I love being a part of Rome Health. I'm so proud to be a part of this network, and I'm excited to get up and go to work because I feel like when I look over my shoulder, I have all of you. And I feel lifted up all the time. So I think I'm supposed to be lifting you all up, but that happens to me every day. So grateful for all of you. I will close with this. Did receive a positive patient acknowledgement just recently, and it said this: our team on 2 East has been caring for my friend's father for several days until he had to be transferred out for dialysis. She said, I just want to say thank you again. I have never met a nicer staff than we have here. Every single person has been perfectly amazing, kind, friendly, and knowledgeable. Thank you. And it gave me chills because it's really living out our mission. Thank you all for providing the best care out there here.